This is NDTV. And you're watching NDTV 24/7.
Good evening, you're watching NDTV with me, Rishika Barua. This is a show where we take your questions on the coronavirus. We'll be joined by an expert panel of doctors. You can dial us on the number that's going to be flashing on your screens in just a bit and call us and tell us what is it that you are facing. If you have any questions related to your health at the time of coronavirus, you can call us on that number flashing on your screens. Joining us on the broadcast this evening is Dr. Dheeraj Kapoor. He's the head of endocrinology at the Artemis Hospital in Gurugram. Also with us is Dr. Hemant Narayan. He's a professor and head of the Department of Cardiology from Ranchi in Jharkhand. Appreciate you, doctors, for being with us on the broadcast. You know, I want to begin by asking you and Dr. Kapoor, if I could bring you in first. You know, there has been very interesting literature about the polio vaccine, and if the polio vaccine that has been administered here in India largely, whether it could actually prevent the spread of the coronavirus, whether it could make us Indians more immune to the coronavirus. What's your take?
There is no evidence as of now to suggest anything like that.
All right. So you're saying that there's no evidence that links the polio vaccine with the coronavirus, because it has been said that it could slow the spread. It doesn't necessarily mean that you won't get the virus, but it could build your immunity and perhaps even slow the spread of the virus. But you don't think that there is anything to suggest that?
No, I don't think there is any hard evidence to suggest that.
All right. So no hard evidence, doctor says, that could perhaps link the polio vaccine. Dr. Dheeraj, if I could bring you into the conversation as well, what's your opinion on the polio vaccine? It's, it is being said that it activates the innate immune system and therefore, could perhaps help in combating COVID-19, the polio vaccine. What's your take, doctor?
So the COVID-19 actually acts through the immunological mechanisms made with the lung kidney injury, and therefore some vaccines are believed, but the data are anecdotal. Like, for example, if someone has been given a BCG for tuberculosis prevention and he doesn't have the disease, so they're trying to link. These are observational studies. There's no hardcore evidence or data to support all this. So this is all observational data, and we need more robust trials on this to be clear about the mechanism. Okay, so you're saying there isn't any robust scientific evidence or research perhaps that has been done in order to be able to back some of those claims. Our first caller, Muhammad Amjad Ali, is joining us from Warangal in Telangana. Go ahead, ask your question.
Ma'am, just I wanted to know, I'm asking this question on behalf of my daughter. They are really concerned about after lifting this lockdown, what are the measures one should have to take? My daughter Salma and Asma, they are asking me to ask this. Just asking this question on behalf of them.
All right. So additional preventions that you can take during the lockdown. Dr. Hemant, would you like to answer some of those questions? What can one do during this period of lockdown, to protect yourself from getting the coronavirus?
See, apart from practicing social distancing, using masks whenever you are getting in contact with any stranger, you should try and improve your immunity with good sleep and good balanced diet. You should be, of course, washing your hands frequently, avoiding touching your eyes, mouth and nose.
Right.
So those things.
All right. So you're saying, essentially a whole standard, set of practices that has been, widely popularized by the government as well. Dr. Hemant, would you like to add anything? Sorry, Dr. Kapoor, would you like to add anything?
So the crux would be social distancing, maintaining hygiene, and of course not to roam about. Ideally, hygiene in terms of food, in terms of social distancing, repeated hand washing, putting on masks, these would go a long way in preventing the further spread.
All right, so pretty standard, process really that can be followed. But, since the caller was asking about his children specifically, Dr. Kapoor, any do's and don'ts for children? Many parents are at this point finding it very hard to keep their children indoors, entertained. There's no school, they can't go out to play. So any particular SOPs as far as children are concerned?
See, SOPs remain broadly the same, but one must understand that children develop symptoms later or lesser as compared to the adults, which may actually be misleading.
Right.
So when we talk of children, I think they are above the age of 6. They have good immunity, but at the same time, social distancing, and they are playing maybe indoors, they should wear masks at all point in time. That is the best. And obviously, these children play with all kinds of things. So hand washing frequently, particularly for meals, is very, very important.
So hand washing is essential, particularly for children, and of course all other precautions should also be taken. Our next caller, Dr. Bhattacharya, is calling from Navi Mumbai. Go ahead, doctor.
Yeah, my question here is that see, we all know that there is no apparent medicine for coronavirus as on date. But when we see on the screen that so many people have recovered, so when we say that people are recovering, how exactly the recovery is happening? I mean, as such, there are no drugs available to cure this disease. So how is the recovery happening?
All right, how is the recovery happening? I think that's a big question in the absence of any kind of a vaccine. Dr. Hemant, would you like to answer some of those questions? What's the recovery process like? We've today understood from the Health Ministry that there is close to a 20% recovery rate here in India. How are patients recovering in the absence of a definitive vaccine?
See, when a patient gets infected, that means entry of the virus into the patient's body. Now, we know 80% of patients will develop mild disease or no symptoms. For example, at my hospital, few days back in our meeting we discussed that out of the 13 patients COVID positive admitted, 12 were absolutely asymptomatic. One had some mild symptoms. So, like any other viral infection, most of the patients will have mild symptoms or no symptoms. It is only 1 out of 6 who may need hospitalization. And these patients with basically symptomatic treatment and antibiotics and the treatment of complications, many of them are recovering.
All right, Dr. Ray, that's extremely useful information. We have a bit of an audio trouble with you. I'm going to get that audio line with you fixed. But let's go off. Let's take our next caller. Pankaj Patil is joining us from Jammu. Go ahead.
Ma'am, my question is, by locking ourselves down, we are only delaying the herd immunity which we speak about. So is it advisable to keep ourselves locked down or improve the herd immunity by, young people being moved out?
All right, very interesting question there coming in. Dr. Kapoor, would you like to take that on? Is the lockdown delaying herd immunity?
See, this is a very controversial issue of herd immunity, right? There are countries who have tried that, but I'm not sure because this is a novel virus. We do not know how it will behave. So as far as we are concerned, I think lockdown is the way to go. In a country of India's population magnitude, if someone has arrested the progress, I'm not saying that stopped totally, but the doubling time of 7.5 days, and that too in such a huge population, I think lockdown is the way to go about. As regards third, it's controversial. We can't go into all that as of now, and we need more data from different countries, how it works, and possibly will be wider with time. But as of now, no, I think lockdown is the way to go.
All right. As of now, lockdown is the way to go, and it is the only way to be able to maintain social distance in order to be able to spread, the coronavirus here, at least in India, where social distancing, especially in crowded places, can become, a near impossibility. On that note, we're going to slip into a very short break. Our doctors will continue to be with us. You can call us with those questions on that number flashing on your screen. Short break. We'll be right back.
Knowledge Partner, USP, your reliable healthcare partner.
Be it engineering, health sciences, or business, become a specialist. Choose from 150 plus specialized programs at our university and go a degree higher. Log on to upes.ac.in today.
Is it just me, or is it getting crazier out there?
Watch now, only on Amazon Prime Video.
When I wanted to take a life insurance policy, I visited the LIC website. It's so user-friendly. You can choose a policy, make a premium payment, and do a lot more. Why go anywhere else?
First, be aware. Try to immediately close with your hand. If you have a kerchief, use that kerchief. Ideally, if you have a mask, use the mask. Step back, because there is a distance to which it can travel. Step back and don't touch anything that has fallen there. If you have touched, you must wash your hands very, very clean. That is very, very important.
ऐसे कभी हमने सपने में भी नहीं सोचा था कि अपन को यहाँ तक मुंबई आने का मौका मिल जाएगा।
जो हमें कभी लाइफ में नहीं हो सकता था वो हमें मिला। हम उषा की टीम है, उन्हें बहुत थैंक यू करना चाहते हैं।
और मैं खुश भी हूँ कि मैं आज इस लेवल पे हूँ, बहुत ज़्यादा खुश हूँ मैं।
कुशलता के कदम brought to you by Usha.
Are you hungry? When did you last eat? The country is in lockdown. Who's feeding you? Are you all alone? Who is taking care of you? They keep telling us to wash our hands, but do you even have water? Does India even know you exist? Do we notice you on the streets? Nearly 20 lakh children like Neelam, Shivin and Omkar live on the streets. They don't have any food to eat, a place to call home, not even a name they can respond to. As we stay home during the lockdown, they are the most vulnerable to infection and death. Bring her out of the shadows. Be a part of the NDTV Save the Children Making the Invisibles Visible campaign this Sunday at 7 p.m. on NDTV. This is your chance to protect a generation.
Checked out the LIC website? Solid info, user-friendly and very today. I'm sure they'll keep pace with me. I'm going for LIC.
कोरोना आज विश्व के लगभग सभी देशों में फैल चुका है। डाबर च्यवनप्राश, जिसकी 40 से अधिक आयुर्वेदिक जड़ी बूटियां करें इम्यूनिटी को स्ट्रॉन्ग। इम्यूनिटी स्ट्रॉन्ग करने के लिए मिनिस्ट्री ऑफ आयुष भारत सरकार ने भी च्यवनप्राश जैसे आयुर्वेदिक उपायों को एडवाइज किया है।
Welcome back. Dr. Dheeraj Kapoor, the head of endocrinology from the Artemis Hospital in Gurgaon, and Dr. Hemant Narayan Ray, professor and head of Department of Cardiology, both continue to be live with us. Let me go to our next caller. Salim is joining us from Hyderabad. Go ahead.
Hi, good evening everyone out there, and thank you for joining on NDTV, and wish you a happy Ramadan to everyone.
Thanks. Could you please ask your question?
So certainly, I just want to ask you 2 to 3 questions to all of you three. Okay, this lockdown is going to extend for a long time. Every time. So first time the Prime Minister Narayan Modi said for 21 days lockdown is being continued.
Right.
And
So I urge you to ask any medical questions on the coronavirus if you do.
Okay, certainly, sure.
Thanks.
So I have another question. Okay, I'm a smoker actually.
Right.
And I even do social drinking as well. So how should I come over with smoking and as well as with drinking?
All right.
Because,
So the impact of smoking and drinking. So if you are a smoker or you do consume alcohol regularly or socially, how should you combat that? Dr. Ray, would you like to take that on?
Yes, as far as smoking is concerned, just stop it. Cessation of smoking is my answer.
All right, but
And
is there proven to be a negative correlation between the coronavirus, and is there perhaps a higher chance of a smoker contacting the virus as opposed to a non-smoker? Dr. Kapoor, would you like to answer that?
See, first of all, smoking and the coronavirus have not been linked.
Right.
And there is no evidence to show that. But it makes lots of sense actually. If you are a smoker, it means your lungs would be unhealthier as compared to the non-smoker, that is one. And a smoker is more likely to have a coronary artery disease or a heart disease. And both of these conditions will negatively impact the disease outcome.
Right.
So it carries so corona or no corona, it carries lots of sense to stop smoking. As regards alcohol, well, it has been known to, he's a social drinker, fine. In the heavier quantities, it can cause liver, pancreas damage, even cardiomyopathy. So I think you should reduce alcohol and stop smoking altogether.
All right. Our next caller, Mayank Desai, is calling us from Mumbai. Go ahead.
Hello, yeah.
Yes, sir. Go ahead. Ask your question.
Yeah, my question is, there is no vaccine and then there is no proper drug available, then how people, what are the treatment people are getting from these hospitals and nursing homes?
All right. So I think Dr. Ray did address that question briefly. Dr. Kapoor, would you like to add anything to what Dr. Ray had already said? He'd addressed, some of the treatments that are being given to patients who are recovering from the coronavirus.
Yeah, so first of all, 80% would recover anyhow because infection spread, but generally it is mild. That is one. Second, we have antiviral drugs like the loperamide which can be used. Chloroquine has been recommended as prophylaxis by the ICMR, and same with azithromycin. Now, azithromycin and chloroquine are to be used together very cautiously because of the ECG changes and the problem which Dr. Ray obviously would be better answering at. But I think there are anecdotal reports about helping out, though no concrete evidence for the same.
All right. So this, of course, it's being treated, like any other viral infection. But it is important that, you don't try and take any of the drugs that a doctor just listed out. You should only take, drugs that have been advised by a doctor. So don't try and go to the chemist and buy, medicines just because you've heard the name on the broadcast. S. Mitra, our next caller, is joining us from Kolkata. Go ahead, sir.
My question is that will it be advisable to go for routine blood test because we have to see our doctors in May. Because I am asking this question because of the present coronavirus atmosphere.
All right.
I have a second question also. Can I put it up?
Yes, go ahead.
As I have to take some immunosuppressing drugs for treatment of my rheumatoid arthritis, will it be safe to go for some immunity booster drugs? These are my two questions.
All right. Dr. Ray, would you like to take on the first question? There's a lot of apprehension of going to see doctors at a time when, coronavirus is so rampant. People are inhibited to go see their doctor or go to the hospital. But there are a whole host of other problems that people are still suffering from.
If it is a routine check, there is no urgency. You should avoid going to your doctor for a routine check.
Right.
If in doubt, give a call to your doctor. And if your doctor says that it is important for you to come and see the doctor, you can go. Regarding the second question, taking immune boosters, I'll say you should practice the routine things to improve your immunity, like good nutrition, balanced diet. You can take things like vitamin A, C and D under a doctor's supervision.
All right. But what about drugs that are being taken for arthritis? Do they, affect your body in any way at a time when there is a pandemic like the coronavirus?
We know that they are immunosuppressant at times, but your disease, if your doctor says that you need to continue those immunosuppressants, you have to.
All right. So it's important that, if you are a patient of any disease and you are taking routine medication, it's important to consult your doctor before you decide to continue or discontinue that medication. Our next caller, Arshad, is joining us from Chennai. Go ahead.
Good evening, doctor. Sir, my question is that suppose that water vendor give the water bottles and Amazon give the stuff delivery in a carton. So is it a good idea that keep these things to in a separate room where kids doesn't have the access to that room, and after 2 days we start to use that and take the stuff from there and the water bottle?
All right, Dr. Kapoor, would you like to answer that? What about what about things that you get delivered home, or a parcel, or even bottles of water that you might buy from outside? Can you leave them for a while before you use them? Does that help? Should you sanitize them? How should you treat these things?
So leaving them for a while is a very vague kind of a comment, because the virus can stay on surfaces anywhere from 5 days to 14 days.
Right.
So it's best to sanitize, and if the carton obviously is washable, then adequate alcohol and maybe soapy water may be used. As regards water bottles, well, it always makes sense to carry water from your home in these trying times. Besides, we are in the lockdowns, water bottles won't be anyways. But as regards to the carton, I think they should be sanitized well. The outer covering is best left outside your home, near in the dustbin, and take the covered part after uncovering it. Take the covered part home.
All right. Our next caller, Mohammad Adil, is joining us from Mumbai. Go ahead.
Good evening, ma'am.
Good evening. Go ahead.
Okay. Ma'am, I was about to hear only Dr. Kapoor. I heard you were asking him about the questions and all. My question is to both the doctors.
Right.
Now, this is 83rd day. We are into COVID-19. The first case came in, I think, on 30th of Jan. And we don't have any precaution for COVID-19, nor any concrete plan, both pre-lockdown and post-lockdown for COVID-19. And as far as the doctors are concerned, whatever PPE kits and whatever instruments we have, that are not reliable. Now, the recent rapid testing kit which we had, that has an accuracy rate of only 5.4%, which has been used by most of the states, including Rajasthan, Haryana, and many states.
What's your question, sir?
So, ma'am, my question is do you think we will be able to reduce the number of cases, because we are already into lockdown? Testings are not going on. Second, Maharashtra is already leading in this with around 5,000, around more than So my question is these cases will increase in future. Doctors are not being provided with the right.
All right. I think there are a whole host of questions that you have. I'm gonna try and address some of those. Dr. Ray, of course, there are apprehensions that despite the lockdown, the number of cases are rising, and there is apprehension on what is going to happen, in the immediate future as far as the number of cases are concerned, because there is also, a belief that as you test more, the number of cases do rise.
Yes, in spite of lockdown, the number of cases are increasing, but definitely this lockdown has gone a long way in controlling this pandemic in India. And most of doctors, just like me, they are optimistic about us being able to control this pandemic.
All right, Dr. Kapoor, would you, like to take on some aspect of that question? I think there's a lot of inhibition on how this plays out. The caller did say that there have been 80 days since the virus has been around. It's actually much more than 80 days. It's over 100 days since the WHO confirmed the first case of the coronavirus. How do you see a pandemic like this play out? What do we learn, from, say, history of Spanish flu or influenza? How do you see this playing out?
See, first of all, on an average, one patient infects 2.6. Spanish plague was 100 years back. Let's talk about more recent, the SARS virus and MERS virus, right? So the MERS virus had a mortality of 37%. SARS virus around 10 to 11%. And this is around 2%, well, in some states 5.8, some states less than that. Now, I ditto Dr. Ray in the sense that this lockdown has gone a long, long way. Look at India's population and look at the other developed nations, how they are succumbing to this. So we have a doubling time of 7.5 days, and this is thanks to the lockdown. I know economy is suffering, but it would have suffered more. So I think lockdown, I suggest, is the way to go.
All right.
And let the development take its own course. But as of now, we are much better placed than other countries. Much better placed.
All right. Appreciate you, doctors, for sparing the time and being with us. That's all we have time for on the show this evening. Thank you for watching. But on the other side, joining us is Sonia Singh for the 8 p.m. news.
Thanks so much. Well, Rishika, the doctors just saying that we're in a better position. And today, the government officially released figures showing that on 30 days of the lockdown. Much more on that after this quick break.